Yes, boys. Today's yes, we will start the first lecture of anatomy. लाइट जला लो, लाइट जला लो. आज क्या हुआ? बस नहीं रखो, ज्यादा मत करो, ज्यादा में हम पाता थे. यस बॉयज, थोड़ी आवाज बढ़ाओ यार. बैक बेंचर्स, आर यू लिसनिंग मी और नॉट? थोड़ी और बढ़ाओ. नाउ ओके? नो? I am asking you, backbenchers, are you listening me or not? No? Now okay? So, anatomy is that branch of medical science where you will study the different part of the body tissues, their position, their relation, their shape. All these will help you in your further medical science. When a doctor is not knowing what is the position of the spleen, what is the position of liver, what is the position of heart, and start inspecting the patient, if doing the stethoscope, if he doesn't know where is the position of the heart, he can keep the stat anywhere. Understand? So, you must be very clear about the different positions and their relation structure by means of our branch anatomy. This anatomy, you will study all these relation structure of different tissues of the body by means of dissection. One, that is cadaveric dissection. You are the lucky chaps that we are providing you cadaver for the dissection. Otherwise, there are many institutes where the cadavers are not available. So I advise you, do the dissection very well. Listen boys, just a minute, stop. All of you listen, in my lecture, if you are late, enter in the class silently and go to the back side. Don't cross in front. I don't want any disturbance once I start the class. And second thing, don't stand there waiting for the permission. I allowed you up to 10 minutes, not more than that. So, we will teach you by means of dissection of the cadaver, one, and second thing, by seeing the tissues, taking the section and study it under the microscope. That branch is called microscopic anatomy. So all these things you will do in the anatomy. Alright. Before talking of the different subdivisions of anatomy and other things, see the diagram which I put, that showing the anatomical position of the body. This is very important because whatever the things mentioned in the books, they are related with the anatomical position. One thing. Another thing, when you will go in the dissection hall, the cadaver is lying over the table. They are not standing in the anatomical position. So don't be confused. Anatomical position is this. That means the person is standing erect. So look this part. The person is standing erect. The feet should be in contact, and upper limb, that is this part, is lying by the side of the body. This is the hand. Hand is having the two surfaces. This is the dorsal surface, this is the palmar surface. The palmar surface of the hand should face directly, front. Eyes are looking straight, not side by side. So this is the anatomical position of the body. So whatever the things we are writing in the words or speaking, all are concerned with the anatomical position. Understand? Second thing, there are the different positions of the patient which can be changed during the operation. When you will enter in the DH, you will find the cadavers are lying on the table, on the back of body surface, back, and the face is looking upward, straight. That position is called supine position. Now see this next. You can see here, the person is lying over the back. Again the feet are closed. Upper limb is by the side and face is looking upwards. So this is the supine position. And next to this, you can see here, just reverse to the supine position. The person is lying over the belly. This is the belly, chest, and this position is called the prone position. This is the prone position. These positions are used while doing the surgery in the operation theatre. Suppose if you want to do the surgery on the kidney or on the back, so the patient will lying on the prone position. If you are doing the surgery on the chest or maybe the anterior part of the abdomen, the patient is lying on the supine position. Right? Next to this, look this position. No doubt, the patient is lying in the supine position. But what is the difference between the first and this? The leg or lower limb is flexed at the knee joint. This is the lower limb, and this is flexed over the knee joint. This position is called lithotomy position. Lithotomy position. And the lithotomy positions are used while deliver the baby. When the doctor delivers the baby by the vaginal port, this lithotomy position is used. Another, it is also used when you are doing the surgery over the lower part pelvic region, and also for the vaginal examination by the gynecologist. That position is called lithotomy position. After this, seeing the different positions of the body, we cut the cadaver, and the dissection of the cadavers are, look, first of all, you must know this is the median plane or mid-sagittal line. That means the top of the body start from the head in the midline. The line is passing downwards. This position, if we cut the cadaver by this position or by this line, that is called, it is dividing the body into two halves, right half and left half. And this plane is called the midline plane or sagittal section. The section is called sagittal section. So when we do the dissection according to the sagittal section, that means the body should be divided into the equal right half and left half. Just opposite to this, this is passing from midline of the body, and just right angle to this, the plane is passing from again from the upper end of the body to downward. This is called the coronal plane. Look here, this is the median plane. Okay, this one is the median plane, and just right angle to the median plane, this is the coronal plane. So if you are cutting the cadaver by the coronal plane, that will divide the body into the anterior half and posterior half. परिमल जी, मैं लेक्चर ले रहा हूँ, अभी बाद में बात करूँगा. So one is the median plane, another is the coronal plane. So cutting the cadaver by the median plane, dividing the body into the right half and left half, and by the coronal plane, dividing the body into the anterior half and posterior half. You can see this diagram also. This is the coronal plane dividing the body this, and just right angle to both coronal plane and median plane. Look this plane. If we cut the bodies by this plane, that is called horizontal plane. हेलो, हाँ बोलिए. अभी बात मत करिए, अभी बाद में बात करूँगा, 1 घंटे बाद. After seeing this plane, before this talk, you must be very clear about the different branches of anatomy. First thing which I told you, in the dissection hall, by doing the cadaver or cutting the cadaver, you will study the different tissues of the body and structure. That part of the anatomy is called gross anatomy. That is the gross anatomy, GROSS, gross anatomy. And second, we study the same thing, structure, relation, tissues, different parts. What is their function, what is their relations, what is their nerve supply, all these. So the part of the anatomy by which we study the structure by seeing the slides under the microscope, that is called microscopic anatomy. The microscopic anatomy is also named as histology. I am telling you these 2 points. No doubt the teachers will use common word histology, go to histology. But in exam the question comes, describe the microscopic anatomy of thyroid or liver or spleen, whatever. So you must be clear that point in your mind, that you have to describe histological part or microscopical part of that tissue. So don't do any confusion. One and the same thing, microscopic anatomy or histology. Next to this, we will also teach you the developmental anatomy. That means how the tissue, how the baby develops into the different parts, starting from the fertilization to the development of the fetus. That part of the anatomy is called embryology or developmental anatomy. That is the another branch. Next branch is, have you seen, or you must be remember the person who were present while the cadaver coat. You have taken the cadaver coat, the cadaver was very thin, dry, and you must be having in your mind that how we will dissect such cadaver. Am I wrong? How many of you think that how we can dissect such type of the body? That cadavers are used for surface marking. We will teach you that the different parts of the body, their relations, where they are present and what is their positions. And that we will teach you by drawing the diagram or by making its measurements and all that things by the chalk, and teach you that this is the part of liver, this is the part of spleen, like that. And that branch is called the surface anatomy. And this surface anatomy is very helpful because once you know that this is the part of liver, this is the part of spleen, and this is related to this ribs and this part, while examine the patient, you are very clear. If you want to examine the spleen, automatically you will put your hand towards the left hypochondric region. If you want to examine the liver, you will put your hand in the right hypochondric region. All these things you will develop by doing the surface anatomy. So my point is that do the surface anatomy very interestingly and perfectly, so you can examine the patient very nicely and having no problem. So that branch is called surface anatomy. Afterwards, you have seen that when the patient comes to the doctor, doctor see the patient, examine the patient, and also if they want to see the interior of the structure without dissection or without doing surgery, they refer for the radioscopic anatomy. That means advise the patient for the X-ray or for the sonography or for MIG and like that. That branch is called radiological anatomy. So what is the radiological anatomy? Where you will study the relations and structure of the different parts by means of X-ray. X-ray is the layman term. We use the part skygram, SKIAGRAM, skygram, whatever the want. If you want the skygram of the chest or X-ray of the chest, but X-ray is the Latin word. You don't prefer this. We prefer skygram of the chest, skygram of the lungs, like that. So that is the radiological anatomy. Next branch is the part where we will teach you how the living patient will examine, palpations, like that. So these are the different branch of the anatomy. Lastly, we will teach also the genetical anatomy, human genetics, how the genes transfer from parents to the offspring. That is the branch is named as medical genetics. So all these are the branches. Afterwards, I told you the different positions and different planes of the body. Besides this, in the different parts, the way of teaching may be of two types. That is regional anatomy and systemic anatomy. In regional anatomy, we will teach you the different parts of the body according to the region. For example, when we use the words head and neck, head and neck region, this head and neck region will also include the relations present, nerves, arteries and muscles. What are the structures present in the neck, that will be teach you in this part. Similarly, over the face, bones, muscles, the nerves, arteries, and also the brain. All these parts we will teach you in the head and neck region. In the thoracic region, we will teach you the lungs and heart, and also the ribs, intercostal muscles, and these. Next part comes the part abdomen. Abdomen again we divide into two. This is upper part is called abdomen proper, and the lower part, which is including the genitals, male and female reproductive organs, and also the rectum, anal canal, that part is pelvis. That these are lying in the pelvis. So abdomen plus pelvis is coming in the one part, abdomen. Then the limbs. In the limbs, this is the upper limb, starting from shoulder joint to the hand, that is upper limb. From the hip joint to the feet, that is the lower limb. So, in the part of limbs, including the upper limb and lower limb, like that. This type of teaching is called regional anatomy. Another branch that is called systemic anatomy. Systemic anatomy, in which we will teach you like the different joints of the body, that is called arthrology, arthology, arthrology, that includes the different joints of the body, all the joints of the body, including the joints of the face, temporomandibular joint, and these joints, and also come to the part of joints, shoulder joint, elbow joint, wrist joints. That means all these joints come under the head of arthrology. The another is neurology. Neurology is including the different type of the nerve supply, including the cranial nerves and peripheral nerves, motor nerves, sensory nerves, all type of nerves, they comes under the head of neurology. Then reproductive organs, both male and female reproductive organs, they come under the head of reproductive organs. Then excretory system, including kidneys, ureter, urinary bladder, urethra, all that. So this type of teaching is called systemic anatomy. This type of teaching is called systemic anatomy. Now the other, with you will come across the different terminology. The terminology which will be used are the word showing last itis, that means inflammation of that part. For example, appendicitis. When you will read, you will find appendicitis. When the doctor prescribes the patient for enlargement of the appendix or any problem of the appendix, he will describe appendicitis. That means inflammation of the appendix. So my point is this: the itis word, if it is used in the last, that means that part is inflammation of that part. Similarly, in the limbs, when you will read first, they will teach you the upper limb. So, in the upper limb, you must know what is the arm. It is dividing into the arm, forearm, and hand. Arm is extending from shoulder joint to the elbow joint. That part is the arm. And the bone present in the arm is the humerus, single bone. Then this is the elbow joint, extending from the elbow joint to the wrist joint. This is called forearm. The bones of the forearm are two. Now listen, I am standing in the anatomical portions. I told you in the whatever the word you will speak or write concerning with anatomical portion. That means the bone which is present close to the body, that is this bone, ulna. So you can say also the medial bone of the forearm is ulna. Lateral bone of the forearm is radius. That means the structures which are close to the midline, this is called medial. Away from the midline, that is lateral. Similarly, this is the shoulder joint. So the structure close to the shoulder joint, that is proximal. That is proximal. Away from the shoulder joint, distal. Similarly, in the forearm, proximal to the elbow and distal, that is close to the wrist joint. Then we also will teach you anterior surface. This is the anterior surface of the arm or forearm, and this is the back. So this is called posterior surface of the upper limb. Come to the hand. In the hand, this is the front. This is called palmar surface of the hand, and this is called dorsal surface of the hand. In the same thing, come to the lower limb. This is the hip joint and knee joint. Which joint? Ankle joints. So, the bones of the part of the lower limb which is in between the hip joint and knee joint, that is called thigh. That is called thigh. Thighs, thigh. The bone of the thigh is the single bone, and that is femur. Come to the knee joint to the ankle joint. Again, similar to the upper limb, forearm of the upper limb, there are the two bones. One is medial side, that is tibia, and on the lateral side, that is fibula. If you see the hand, in the hand, this is the wrist joint. The wrist joint is having the 8 carpal bones. They are present in 2 rows, proximal row and distal row. In each row, there are the 4 carpal bones. Articulate with the carpal bones. In the part of the hand, there is metacarpal bones. The metacarpal bones are 5 in number. Articulating with the metacarpal bones, these are the bones of the part of the fingers. The point is this, that same pattern you will see in the part of foot. In the ankle joint, no doubt, the bones are not tarsal bones. They are called the tarsal bones. And tarsal bones are 7 in number, not 8 in number. Then similarly to the metacarpal, there is metatarsal, again the 5 in number. And similarly to the part of the fingers, there are the toes. So that is the pattern of the limbs. Now see this diagram. Look this one. When the structures, when we talk of the visceras, when we talk the interior part of the organs, in the organs, if it is the structure is going inward, if the structure is going inward, that is called invagination. This one. And if it is comes out, that is called evagination. Similarly, the structure which are close to the skin or above, that is called superficial. I am talking of this one. The structure which are close to the skin, that is called superficial, and the structure which is lying deep, that is called deeper structures. So these terms we will use while teaching you the part of different visceras. If the structure is invaginate, that is called invagination. And this diagram, they are showing the movements of the limbs. Again, now look, when we ask flexion at the shoulder joint, this is not flexion at shoulder joint. This is flexion at the elbow joint. So don't do this mistake. Generally the students, either they forget or they don't understand. When we ask, show me the flexion at the shoulder joint, they do. No. Flexion at the shoulder joint, keep your hand here. This is the flexion. The movement should be taken at the joint. And this is the extension at the shoulder joint. Follow? This is the extension at the shoulder joint. This is the flexion at the shoulder joint. Okay? Then another thing, adduction. Adduction means close to the midline. So this is the adduction. This is abduction, away from the midline. And all these movements, adduction, abduction, flexion, extension, the combination of all these movements is done by the cricket player, bowler, while doing the bowling. They are moving like this or not. So all these movements, they come simultaneously, flexion, extension, abduction, adduction, at the part of shoulder joint. The same thing we will do in the part of hip. This is the flexion, this is extension, and this is circumduction and abduction, adduction. Now look, this is showing the medial rotation. Now look, we are keeping our hand here. I am using the word medial rotation. There must be rotation. And look, I am keeping in normal position. Now medial rotation, this is medial rotation. This is medial rotation and this is lateral rotation. So in rotation there must be the movements at the joint. So this is medial rotation and this is lateral rotation. Don't confuse this with abduction and adduction. Abduction is this one, adduction is this one. If you want to do the at the forearm, I am not doing any movement. This is abduction, this is adduction at the forearm, and medial rotation this one, this is lateral rotation. Now see this one, this is important. Look this part. In the anatomical position, if the teacher asks you, show me the supination of the hand, this is supination, or you can say supination is just like a hand of beggar. Not how the beggar, they want money by putting the hand like this. So this is supination and this is pronation, donor. This is pronation. So what are these? Supination of the hand. Try to understand. Standing in the anatomical position and supination of the hand. This is supination of the hand. And this is pronation of the hand. You can see here, this is supination. The crease of the hand are visible. Okay, and in the pronation it is hide. Then another part, opposition of the hand. In opposition of the hand, this is the thumb. So touching of the hand, thumb with the different fingers, tip of the different fingers. This is the part opposition. You can see the diagram also. This is the opposition of the hand. Now see this one, the movements at the hand. If you are replying properly, the teacher will ask you, show me the flexion of the thumb. This is the thumb. I am not telling you the hand. Flexion of the thumb. I am not touching the fingers, tip of the fingers. This is flexion of the thumb. This is extension of the thumb. Flexion of the thumb and extension of the thumb. Okay? See another one. Adduction of the thumb and abduction of the thumb. You are do this movement, you will feel hardness. This is abduction and this is adduction. I am showing you again abduction, adduction. फ्लेक्शन, एक्सटेंशन। करके देखिए आप, डू योरसेल्फ। फ्लेक्शन, एक्सटेंशन, adduction, abduction. Okay, no problem. This is a position. See this movement. I am talking of this. These are the movements. So, see carefully. This is the wrist joint. Understand? Flexion, extension. Keep your finger at the wrist joint and do the movements. Flexion, extension, flexion. So these are the movements taking place at the wrist joint. So don't do this movement, flexion, extension. These are taking place at the elbow joint. So you should be very clear that where the teacher wants these movements. At the elbow joint, do like that, extension, flexion. Wrist joint, flexion, extension. Okay, and in case of feet, we say, as I told you here, the two surfaces, dorsal surface of the hand and palmar surface of the hand. In the feet, the part of the feet which are touching to the ground, that is called plantar surface. That is called plantar surface. And the surface which is above, that is called dorsal surface of the feet. So, this movement, this is plantar flexion and this is extension. How I can show you? Should I keep my feet here? Yes, what do you want? Are you student of first batch? Why you come so early? Are you coming first time? Enter and sit. And next time, go from that side. And your classes will be started since 9. Now look, this is the plantar flexion and this is dorsiflexion. Keep your feet downward. Keep your feet downward. This is the dorsiflexion and this is the plantar flexion. Now see this diagram. This is flexion at the which joint? See this one, flexion at the knee joint. And when we are standing, what is the position? Extension. Extension at the hip, extension at the knee joint. And see this one, the important part, look here. This is dorsiflexion, which I told you. This is plantar flexion. This one. This is the plantar flexion and this is the dorsiflexion. Another thing. I am keeping my plantar surface facing towards medial side. This is called inversion of the foot. Inversion of the foot. And this is called eversion of the foot. See this diagram. Eversion and this is inversion of the foot. And see this one. This is called circumduction of the lower limb. Means including all the flexion, extension, medial rotation, lateral rotation. Combination of all these is called circumduction of the lower limb. Like this. Don't use for as a cricket bowler. Now I am coming to this part. Look, when we do, this is the medial surface of the upper limb and this is the lateral surface of the upper limb. So all these terminology we will use and you will read as the different parts of the chapter, you will come across these terminology. So that is all this part. Now another thing, that how many of you having the apron? Almost all of you. Good. And have you seen the list of the books which I kept over the notice board? Good. If you will do like this, I wish that all of you will clear the medical teaching very clearly and within one shot. I advise you that attend all the classes. How much you are intelligent, that will not affect. The point is that you will know the things, what are the parts which we have to reach and what are its relations and what are its attachment and in which books it is given, and because every teacher will teach you, they will consider the many books. We are not advising you to purchase the many books. I put over the notice board in orders A, B, C, D. Naturally, the books mentioning over the A is better because I advise only those books in which the language are clear. Another thing, they clear in short, point to point. Because we are not the students of the commerce or arts where we fill the papers. No. You also give the answer point to point. In exam, don't consider in your mind that if you will write in short, you will not get the marks. Clear yourself. We want the answer, correct answer, point to point. And another important part, betterly you draw the diagram and level the diagram. Suppose the question comes over the describe the axilla. This is the axilla. Understand? The boundary of the axilla, the contents of the axilla, the boundary, the anterior boundary, the posterior boundary, all these they are formed by the which muscles and what are the contents, which are the nerves, what are the arteries which are present here. So all these things we want. If you will draw the diagram of the axilla, in which definitely you will mention all the muscles, the contents, the examiner will see the diagram. Listen, how we check the copies, because we need not to read if you draw the diagram well leveled. See the diagram. If your diagram is perfect, that means you know the structures. Understand? So try your best. When you describe the or answering the question, draw the diagram, well leveled diagram. The same thing in the histology. In microscopic anatomy, no doubt, the students are doing the mistake. What the mistake they do? Suppose the questions ask you, describe the microscopic anatomy of liver. I am telling you this point. I don't want any mistake done by you. Describe the microscopic anatomy of liver. Here, you have to describe the microscopic picture that you will find the hepatocytes, the portal triads and sinusoids, that all will be shown in the diagram and well labeled. That this is sinusoids, this is portal triad, like this. But some students, what they do, they draw the diagram, just draw the diagram and describe the gross anatomy. I am telling you that how. If I find this picture, I will give the 0. I will give the 0. And later on the student will tell, I have written so much and I didn't get the marks. I am telling you all these things that don't do this mistake. We are not asking you the gross anatomy. We are not asking you what is the nerve supply, what is the blood supply, what are the relations, what are the things, what is their functions. You have to describe only the microscopic anatomy. Draw the well level diagram. The liver is covered by the capsule, that is called this one, Gleason's capsules, and it is given the dividing the liver into the different lobules. Each lobule is having the portal triads, the hepatocytes, like this. So that means how we identify the slide. When you become doctor, you will see the pathologist. Pathologists, they take the tissue, make the slide and examine the slide under the microscope. Normal picture and pathological condition. That is, what are the disease part and what is the normal part. So, you must be very clear about that what you will see in the normal picture. And beside the normal picture, the other things which are you seeing under the microscope, that will show the pathology. Understand? So the part is this. After teaching you the different parts, different tissues under the microscope, we will in exam, we will put the slides under the microscope and you have to identify the slides. Now, the same thing, suppose we want to go somewhere else, as that girl was telling you, she was telling that she was not knowing where she had to attend the class. Similarly, you must be knowing very clearly how we identify the slides. That means identification points. That if we see hepatocytes, rows of the hepatocytes, on one side there is a dilated space that is called sinusoids and portal triads. All these things are visible, that means the slide is of liver. Similarly, take the part of trachea, any part where you will find the cartilages and all that. So, in microscopic anatomy, nothing gross is required. You have to draw the well level diagram and point of identification. You will get the full marks. So this will help you. Unnecessary, you will wasting the time, which is not necessary. And while doing the wasting time at one place, which is not required, you will left the questions because the time is limited. You will miss the time. So try to understand, write the answer point to point, not go in details. What the question asks you, describe that. You will get the marks. So don't keep in your mind this point that as the number of pages we will write, we will get the good marks. Generally, this is the fault of the student. When I was student, naturally the student will say after giving the exam, I have filled up 3 copies, I have filled up 4 copies. The other student which he do in single copy undergo the depression. So this is wrong. Don't develop this habit. Okay, write point to point and don't compete that I have written the 4 copies, 3 copies. unnecessary. And when they will see the marks, they will get very less marks, and they start abusing the teachers. Am I wrong? So don't develop this habit. Right? Point to point. You will get the good marks and need not to abuse anyone. And another thing which I am telling you, because I need not to tell you keep silence, keep silence. Why? You are future doctor. There is a difference between you and other students. And I also don't expect that sit in the dissection hall 2 hours very silently. That is not possible. Talk, but not in shouted. Just talk very lightly. And betterly, whatever the dissection you have done, discuss that. There is this muscle. What is this muscle? What is the action of the muscles? What is the nerve supply of the muscles? Blood supply of the muscles? So when you will discuss like this will retain the things for longer time in your mind. For example, I have read the shoulder joint. The students on the table decide that next day we will talk about this part, and on the next day discuss that part. Automatically you will feel that how much part you realize, understand, and how much part you forget. So that will help you to retain how to retain the things, because the medical study is very difficult. Difficult in sense, I am not depressing you. Difficult in sense that if you think that we will read the books and give the exam, it is difficult. The part how many you will discuss and see in the dissection hall. Suppose you have done the dissection of the front of the arm. See that part. This is this muscle, this is this artery, and this is this one. Then on the next day, you ask your other friends, what is this? Identify. What are its action? So if you will do like this, you will not feel any problem. The anatomy will be just in your tips. So develop this habit. Okay? And I am not telling you that don't talk. Talk, but not make any noise. Another point, I never took the attendance. In my 40 years life, I never took the attendance of the students. I don't expect. I expect the students, why they think that the teacher will take attendance. If you are not interested in the class, don't come. Follow? Because, try to understand. After doing MBBS is not sufficient. Only MBBS is not sufficient. You have to do the further teaching. So betterly attend the classes, because MCQ questions, they can be asked from any point. And it is not possible to you to see the many books. We are considering the many books. So attend the classes, and any part which can be asked in MCQ will be helpful to give you answer. So now you understand attendance is required. Automatically you will be sincere. So remain sincere. Attend the classes sincerely. After the class, enjoy fully. Whatever the things you do sincerely. Attend the class, remain sincerely. By that time, your mind should go here and there. And after the enjoyment, fully enjoy it. Okay? Now, after this, you will go in the dissection hall. And remain there. There we will allot you the tables also. And Daily you will sit your corresponding tables. We will give you the allotted you on 25 students on one table. From the next week onwards, I will allow to the staff to put the